thank you guys both so much for being here. I kind of can't believe this is happening. So I'm so honored to be here. I'm so happy for the attention you guys are bringing to this topic because to be honest with you, it's been hard to be a doctor the past couple of years.
Yeah.
I mean, it's just, and I feel a little bit ashamed about saying that because I understand what a privilege it is to take care of others.
Right.
So this, this just bringing this to light, this conversation. So, Dr. Murthy, I wanted to ask you the question about, in your speech you talked a little bit about, and I had never heard this statistic before, how 50% of healthcare workers were reporting at least one mental health condition. Why do you think this is happening now?
Well, I think the pandemic has had a big impact. It's really increased the demands on our health workers across the country. It's also unfortunately subject them to verbal and physical abuse. About 8 in 10 health workers say they've been subjected to this kind of abuse during the pandemic.
Yeah.
And all of this is happening also against a backdrop of growing administrative barriers to care. Most nurses, doctors who go into the profession, they want to spend time with patients and help them. They're finding that more and more administrative burdens and paperwork burdens that come in between them and the people they're trying to serve. Finally, just keep in mind that all of these concerns are taking place in the absence of adequate support.
Yeah.
So many healthcare workers don't have access to mental health care.
Yes.
They don't have often the flexibility they need to be there for their families during their times of need, which creates added stress. You put all this together, and you have the burnout crisis that we're managing today.
Yeah. And I think it's also a cultural thing, going through training and instead of reading my body cues, it's just like, let's drink more coffee, let's get through this. And let's,
Right.
and you just kind of power through that moment in time because you want to be there, you want to help others, you want to do exactly what you're doing. Vice President Harris, if you could say something to a healthcare provider, like who's right in the trenches of going through that right now and struggling with whether or not to talk about this and to come forward with how they feel about their mental health, what would you say?
You are not alone, and we care deeply about you as you care for the rest of our society, and we want to help you. And part of that is about our responsibility to step up and make sure that you have the support in the system, the support that you need. Because you do God's work. It truly is, it's a gift that you have to care for others. Most often, people you've never met before. And you have a gift that you give the rest of us as a society. But it takes a lot to be able to go to work every day, often with very little sleep, to see what you see, if it's in an emergency room or a NICU, or what you see in terms of human suffering. And you do it with a sense of optimism, knowing that you have the strength to hopefully lift people up, to lessen their burden, lessen their pain, or give them a sense of optimism that everything's going to be okay. But that takes a lot for you to give of yourself, in addition to the skill that you bring to the work that you do. And so we who benefit from that have a responsibility to understand what it takes. Not to mention, over the last 2.5 years, how much we have asked of you. In the midst of a pandemic of a proportion we have not seen in generations. In the midst of all of the added pain and suffering that has happened over these last 2.5 years. So we're here because the President and I and the Surgeon General, we feel very strongly that we have to do more. In addition to thanking you, it has to be about action that actually puts the support in the system. And so that's what we're here to announce. That's what we're going to continue to do. And this is a lifelong commitment on my behalf, I know on the Surgeon General and the President, to pay attention to this. I often say, part of the failure in our system has been when we think of healthcare, we act as though the body starts from the neck down.
Yes.
What about the
Yes.
healthcare from the neck up,
Yeah.
right? And that's
Yeah.
what this is about, understanding the whole human being and what people deserve in terms of support. Understanding the pain that they may experience that we may not see, but it exists. And we should not require anyone to silently suffer. So that's why we're here.
Well, thank you. Thank you for being here, and thank you for continuing this conversation about mental health being health, being a part of your health,
Yeah.
because I think that's so important, and I think that's something that, just like you were saying, it got glossed over for so long,
Yeah.
and it still continues to get glossed over. As healthcare providers, like, how can we, for the people that are truly making these changes and hearing our voices, what can we do to make these changes happen better?
Well, first of all, let's talk about it loudly.
Yeah, I can do that.
Not quietly.
Yeah,
Let's talk about it in proportion to what we know needs to happen in terms of bridging the gap.
yeah,
And so that means, one, talking about the fact that it's healthy to talk about it.
yeah,
It is a matter of health care. It is about making sure people don't silently suffer. It is about getting rid of the stigma. It is about also understanding that it is a sign of strength to ask for help. Not weakness, it's a sign of strength to ask for help.
yeah,
But then we who are in positions of leadership have to make sure the help is there when it is requested.
yeah,
So it is everyone's responsibility to participate in this, but the other reality of it is that the issue of mental health is an issue that affects everyone.
Yeah.
Usually the dividing line is only in whether people are willing to acknowledge it, to recognize it, and to deal with it.
yeah. I would wholeheartely agree, but it makes a big difference knowing that it's being heard.
Yeah.
That we're down here and you guys are listening. That's huge. That's huge.
Absolutely, and this is something the president, the vice president, and I, we all care deeply about this because we know that the healthcare of our country, the healthcare security of our country depends on our health workers. That's why we're so concerned that 1 in 5 doctors are saying that they plan to leave their practice. If 2 in 5 nurses, 40% of nurses are saying that they plan to leave. What are we going to do without them? How will people get basic primary care? How will they know that there's someone there for them when they get sick? So this is why this is such an urgent issue for us to address. It's why it's not just an issue for health workers to be concerned about. It's an issue the entire nation should think about and look at as a national priority. And finally, just consider that this is even about more than health workers themselves. This is like a fundamental value question. We have an opportunity coming out of this pandemic to fundamentally ask ourselves, what kind of society do we really want to be?
Yeah.
How do we get back to our core values? And I believe that one of our core values is that we are stronger when we take care of each other and when we care for those who are doing the same.
Yeah.
So that's what we've got to do right now. That's taking care of health workers is about safeguarding our healthcare system and living up to those values.